Astronauts Suni Williams and Butch Wilmore recently returned to Earth after an extended 9-month mission aboard the International Space Station, ISS, significantly longer than their initially planned 8-day stay. Prolonged exposure to microgravity and the space environment can have profound effects on various physiological systems. Here's a detailed overview of the health implications they may face. Musculoskeletal system. Muscle atrophy. In microgravity, muscles, especially those in the legs and back, are underutilized, leading to muscle weakening and atrophy. This can result in decreased strength and endurance, making routine physical tasks challenging upon return to Earth's gravity. Bone density loss. Astronauts can experience a monthly bone density reduction of 1–2% in weight-bearing bones due to the lack of gravitational forces. This loss increases the risk of fractures and may lead to osteoporosis-like conditions. Cardiovascular system. Fluid redistribution. Microgravity causes bodily fluids to shift toward the head, leading to facial puffiness and increased intracranial pressure. This redistribution can affect cardiovascular function, potentially causing dizziness and orthostatic intolerance, difficulty standing upright, upon return to Earth. Heart atrophy. The heart muscle can weaken and decrease in size due to reduced workload in space, as it doesn't have to pump blood against gravity. This atrophy can impair cardiovascular efficiency. Neurological effects. Vision. Impairment. Fluid shifts can lead to increased intracranial pressure, causing structural changes in the eye and resulting in vision problems. Some astronauts have reported flattened eyeballs and altered vision during and after long-duration missions. Balance and coordination. The vestibular system responsible for balance is affected by microgravity. Upon return, astronauts may experience dizziness, balance disorders, and coordination challenges as their bodies readjust to Earth's gravity. Immune system. Immune suppression. Spaceflight can weaken the immune system, making astronauts more susceptible to infections. T-cell function may be impaired, and latent viruses, such as the Epstein-Barr virus, can reactivate during and after missions. Radiation exposure. Increased cancer risk. Beyond Earth's protective atmosphere, astronauts are exposed to higher levels of cosmic radiation, elevating their long-term risk of developing cancer. The radiation dose received during a week in space can be equivalent to a year's worth of exposure on Earth. Rehabilitation and recovery. Upon returning, astronauts undergo intensive rehabilitation to readjust to Earth's gravity. This process includes physical therapy to rebuild muscle strength and bone density, cardiovascular exercises to enhance heart function, and balance training to recalibrate the vestibular system. The rehabilitation period can last several weeks or even months, depending on the individual and the mission duration. Understanding these health implications is crucial for preparing astronauts for long-duration missions, such as those to Mars, and for developing effective countermeasures to ensure their well-being during and after space travel. Addressing the health issues experienced by astronauts after prolonged space missions is a critical aspect of post-mission recovery. Here's how these challenges can be managed and how long it generally takes for astronauts to resume normal lives. 1. Musculoskeletal recovery rehabilitation. Astronauts undergo targeted physical therapy to rebuild muscle mass and bone density. Resistance exercises and weight-bearing activities are prioritized to stimulate bone regeneration. Nutritional support. A calcium and vitamin D-rich diet, sometimes supplemented with medication like bisphosphonates, can aid in bone recovery. Recovery time. Muscle strength may return within 3 to 6 weeks, but bone density recovery can take up to 12 months. 2. Cardiovascular adaptation. Reconditioning exercises. Cardiovascular workouts such as cycling, swimming, and treadmill training are essential to restore heart function and endurance. Monitoring. Regular cardiac assessments ensure the heart is adapting well to gravity. Recovery time. Most astronauts experience cardiovascular normalization within a few months. 3. Neurological and vestibular rehabilitation. Balance training. Specialized vestibular rehabilitation programs help retrain the inner ear and brain to respond to gravity. Virtual reality, VR, therapy. VR environments can simulate motion to help restore balance and coordination. Recovery time. Balance issues typically resolve within 2 to 4 weeks, though some mild symptoms may persist for months. 4. Vision and intracranial pressure management. Ophthalmologic care. Regular eye exams and imaging are performed to monitor optic nerve changes. In severe cases, corrective lenses or surgical intervention may be needed. Fluid regulation therapy. Diuretics or medications to reduce intracranial pressure might be prescribed. Recovery time. Vision changes may persist for months to years in some cases. 5. Immune system recovery. Immune-boosting therapies. A nutrient-dense diet, rest, and possibly immune-enhancing supplements are recommended. Medical monitoring. Frequent health checkups help detect and manage any infections. Recovery time. The immune system generally recovers within a few weeks to months. 6. Radiation damage management. Medical surveillance. Long-term health monitoring is essential to detect early signs of cancer or other radiation-related conditions. Preventive strategies. Antioxidant-rich diets and medications that protect against radiation damage are studied for future missions. Recovery time. While acute effects subside within weeks, the increased cancer risk remains lifelong. Returning to normal life. Psychological support. Counseling and therapy sessions help astronauts process the psychological impact of prolonged isolation and reintegration into society. Gradual resumption of activities. Astronauts typically follow a phased return to normal tasks, first resuming administrative work before more physically demanding activities. Overall timeline. While basic physical functions can normalize within 2 to 3 months, full recovery, including psychological well-being and bone restoration, may take up to a year. These recovery protocols are tailored to each astronaut, ensuring a safe and steady return to normal life. The knowledge gained from their rehabilitation is also applied to prepare future missions, particularly those aiming for Mars and beyond. Let me know if it was worth it at all. Please subscribe, like, and share for more intriguing episodes.